All right, future nurses. You're knee-deep in critical care right now, prepping for the NCLEX. And we're diving into one of the toughest topics out there. Shock and sepsis.
That's right.
You've got your notes and textbooks, maybe some practice questions.
Yep.
But we're going to help you feel really confident about tackling this.
Absolutely.
Not only on the NCLEX, but in the real world as a nurse, too.
And it's one thing to just memorize facts.
Right.
But when you really understand the why behind them,
Yeah.
that's when you can provide the best possible care for your patients. And that's what makes you a truly prepared nurse.
Exactly. So let's start by breaking down this whole concept of shock.
Okay.
It sounds kind of scary, doesn't it?
It can be?
I always think of it like a power outage in the body.
Oh, I like that.
Like all the lights start flickering, systems are shutting down.
Yeah.
Got to get things back online ASAP.
That's a great analogy because in shock,
Yeah.
the body's delivery system,
Okay.
the circulatory system, it can't get enough oxygen-rich blood to those vital organs.
So it's like
Exactly.
the engine sputtering.
And just like there are different reasons why a power outage might happen.
Yeah.
There are different causes of shock.
Right, like a burst pipe.
Exactly, hemorrhage.
Or a blown transformer.
Like heart failure, yeah.
Oh,
Or even like, faulty wiring,
okay.
which could be something like sepsis.
So if we're thinking about a patient, you walk into a room.
Yep.
What are the red flags?
What makes you think, uh-oh, something's not right here?
Exactly. What are those signs?
Well, you can remember it with the acronym itself.
Oh, really?
SHOCK. So S,
Okay.
skin pale and clammy.
Yep.
H, heart rate's racing.
Got it.
O, output of urine's decreased.
Makes sense.
C, changes in mental state.
Oh, yeah.
And K,
Yeah.
killingly low blood pressure.
So that's like your rapid assessment.
Exactly.
And it screams, we need to act fast.
Absolutely.
Don't forget about respiratory rate, too.
Oh, that's so important.
The body's trying to compensate for the lack of oxygen.
Exactly.
And, they might even say they feel cold or weak.
Right, those subtle things. Sometimes those are the biggest tip-offs.
They can be, for sure.
Yeah.
Now, our notes break down different types of shock.
Yep.
It's almost like the body gets to choose its own adventure.
It really is.
How to go into shock.
Yeah.
So we've got hypovolemic shock,
Right, where the tank's running low.
like after major bleeding.
Exactly.
Then there's cardiogenic.
Where the heart,
Yeah.
the engine itself,
Mm-hmm.
it just can't pump effectively.
And then we've got, what is it, distributive?
Distributive, yep. That's where those pipes
The blood vessels,
get all wonky and...
causing the pressure to drop.
Yep.
Okay, walk us through those distributive types. I always get them mixed up.
Don't worry, I have a little trick for remembering these.
Okay, good.
Imagine a triangle.
All right, a triangle.
At the top, we've got neurogenic shock. That's where the nervous system's gone haywire. Like after a spinal cord injury,
Yeah.
you get this sudden drop in pressure because those blood vessels just relax way too much.
Okay.
At the bottom left corner, we've got anaphylactic shock.
Okay.
It's a super allergic reaction where the body is basically attacking itself.
So we're talking hives, wheezing.
Yeah, airways closing up.
That's got to be terrifying for patients.
It absolutely is.
Right.
And it happens so fast. Recognizing and treating it immediately is critical.
What are the key things to look for there?
Well, you've got the classic signs we talked about before, low blood pressure, rapid heart rate.
Right.
But you'll also see things like swelling, difficulty breathing, and changes in mental status.
And treatment.
Epinephrine is your go-to. It's like hitting the reset button on the body's immune response.
That makes sense.
We might also give antihistamines and steroids to calm everything down.
Okay.
Now, over at the right corner of our triangle,
Yeah.
we've got septic shock.
Septic shock. So that's where an infection just spirals out of control.
That's right. It can start as something seemingly small.
Like a UTI.
Exactly. Or even a skin infection.
Wow.
But if it's not caught and treated quickly enough,
Yeah.
it can lead to this system-wide inflammatory disaster that we call sepsis. And that's when things get really dangerous.
So we were talking about the cytokine storm earlier. Is that what's happening in septic shock?
You got it. It's like the immune system throws a wild party.
A party.
Well, not a fun party. It's more like a riot. The immune system releases all these inflammatory chemicals
Cytokines.
right into the bloodstream. And instead of just fighting the infection,
Yeah.
it causes all this damage to the body's own tissues and organs.
Oh, what happens?
Well, you get leaky blood vessels, blood clots forming everywhere, and then those organs start shutting down, almost like a domino effect.
So if we suspect sepsis,
Yeah.
what are the key lab tests? This feels very NCLEX-ly.
It is. You want to be thinking about blood cultures.
Okay.
To pinpoint what bacteria is causing the infection, lactate levels are important too.
Lactate. What does that tell us?
Lactate tells you how much the tissues are being starved for oxygen. And then there's procalcitonin.
Procalcitone.
Yep, that's a marker of inflammation.
So it helps us gauge how severe the sepsis is.
Exactly. Early recognition is key here.
Speaking of severe, we were talking about that domino effect leading to MODS.
Right.
Yeah.
Multiple organ dysfunction syndrome.
It sounds pretty terrifying, like the body's just overwhelmed.
It is, and it can happen so quickly.
So what are those early signs we need to be looking out for?
Well, they can be subtle. A slight change in mental status,
Okay.
a drop in urine output, a sudden spike in heart rate.
So we have to be like detectives at the bedside,
Exactly.
putting the pieces together.
Absolutely.
Okay, so let's say we're thinking shock.
Yeah.
What are those immediate interventions we need to jump on?
First things first. We've got to secure the airway, make sure the patient can breathe.
Okay, that makes sense.
Then it's all about supporting circulation.
So that means
Fluids, often lots of them. And sometimes medications.
what kind of medications?
Well, we might give medications to help squeeze those blood vessels tight
Okay.
and boost that blood pressure back up.
Get them back to normal.
Exactly. And of course, we need to treat the underlying cause of the shock.
So there could be surgery to stop bleeding.
Exactly.
Antibiotics for infection.
Yeah,
Epinephrine for anaphylaxis.
you got it. Whatever it takes to fix the root of the problem.
And don't forget those frequent vital sign checks. It's like taking the patient's pulse on the situation.
Absolutely. Trends are our friends. If things are heading in the wrong direction,
Yeah.
we need to catch it early and adjust our game plan.
It's easy to get caught up in the numbers and the meds and everything.
Right.
But we can't forget that we're dealing with real people in these situations.
That's so important. It's not just about fixing the physiological problem.
Right.
It's about caring for the whole person.
Exactly. I mean, imagine how terrifying this must be for the patient and their family.
Absolutely. Clear communication, honest answers, and genuine empathy can make all the difference in the world.
Okay, so to wrap things up, if there's one thing our listeners take away from this deep dive,
Yeah.
what should it be?
Trust your gut. If something feels off with your patient, don't hesitate to speak up and advocate for them because
Their voice.
and their protector.
You got it.
And remember, you've got this. Keep practicing, keep learning.
You're going to be amazing critical care nurses.
And until next time,
Stay curious.
and keep those brains sharp.
Absolutely. See ya.
Bye.